Hip bone, part C, the important question for exam preparation. Name the joint formed by the hip joint, the sacroiliac joint, the pubic symphysis, and hip joint. This is plain variety of the synovial joint. This is secondary cartilaginous joint, and this is the ball and socket variety of synovial joint. Here, articulation occur between ilium and the sacrum. Pubic bone, the pubic part of the two hip bone is articulated with a fibrocartilage and from the secondary cartilaginous joint. Here, the head of the femur is articulated with the acetabulum of the hip bone. The following feature of the iliac part of the hip bone: two end, upper end, lower end, and three border: anterior border, posterior border, and medial border. Three surface: iliac fossa, sacropelvic surface, and the gluteal surface. And iliac crest has four spines: anterior superior and anterior inferior iliac spine, posterior superior and posterior inferior iliac spine. The side determination of the hip bone: acetabulum face laterally, ilium or flattened expanded part is above the acetabulum, and obturator foramen lies below the acetabulum, pubic being anterior and ischium posterior. The attachment of the iliac crest: there is a ventral segment from outside to inward. It is divided into outer lip, and attachment is fascia lata, including iliotibial tract, tensor fascia lata, extending from the anterior superior iliac spine to the pubic tubercle, and external oblique abdominis muscular insertion from the anterior 2/3, latissimus dorsi, posterior 1/3, intermediate area, internal oblique abdominis muscles origin, the inner lip, transversus abdominis muscles, and quadratus lumborum. Dorsal segment of the iliac crest: outer lateral part originate from the gluteus maximus muscle and medial side erectospinae muscle. All the muscle attached to the iliac crest take origin from it except the external oblique muscles of the abdominal wall, which is inserted into the iliac crest. In adult, iliac is one of the sites that contain red bone marrow, and therefore it is the site used for bone marrow transplantation. The highest point of the iliac crest, slightly behind the midpoint between the anterior and posterior superior iliac spine, just at the level of lower border of lumbar 4 vertebral spine, above or below which is lumbar puncture, may be performed. The attachment of the pubis, pubic tubercle, medial end of the inguinal ligament, and apex of the lacunar ligament, ascending lobe of the chiastic muscle. Pubic crest, the lateral head of the rectus abdominis and pyramidal muscle, and posterior surface of the body of the pubis, levator ani and obturator internus muscles, and anterior surface of the body of the pubis and sacropubic ischiopubic ramus, outer surface, the adductor longus from the angle between the pubic crest and the symphyseal surface, the gracilis from margin of the pubic symphysis pubis, the inner border of the pubic ramus, ischiopubic ramus, and adductor brevis lateral to the gracilis, obturator externus, area adjacent to the obturator foramen and from the obturator membrane, and adductor magnus chiefly from the ischial ramus. The ischial tuberosity is divided into two parts, the upper part and lower part by horizontal line, and there is the lateral area and medial area. The superior lateral area is attached with the semimembranous muscle, and inferior medial area is attached with the semitendinosus and long head of the bicep femoris, and the lower part again divided by a vertical line, and lateral part and medial part. The lateral part is area for the attachment of the adductor magnus. The medial part is fiber fatty tissue, which fiber fatty tissue, and there is a sacrotuberous ligament also attached here, and ischiofemoral ligament lateral border just below the acetabulum. The difference between male and female hip joint are as follow. There is a separate YouTube video of my channel for this, but here the important points I mention. The iliac fossa is deep in case male but shallow in case female. The curvature of the iliac crest is more pronounced and less prominent in case female. Acetabulum is larger in case male, smaller in case female. The distant pubic symphysis and acetabular margin in almost equal diameter of the acetabulum, but more than transverse diameter of the acetabulum. Pubic crest is shorter but longer in case female. Obturator foramen is oval and large in case male, triangular and small in case female. Gatocytic nodes is narrow in case male but wider in case female. The ischial spine is inverted in case male, everted in case female. The ischiopubic ramus thick and more everted, thin and less everted in case female. Preauricular sulcus not conspicuous, and preauricular sulcus is deeper. How hip bone is ossified? Hip bone ossified from three primary centers: one for ilium, second month of the interuterine life; one for ischium, third month of the interuterine life; one for pubis, fourth month of the interuterine life. Secondary center: two for iliac crest, two for Y-shaped tri-radiate cartilage of the acetabulum, one for ischial tuberosity. The ilium, ischium, pubis all fuse at the 7 to 9 year, and within 25 years this tri-radiate cartilage is replaced by bones. So this is all about hip bone part 3. If you like this video, please press the like button. Please subscribe my channel. Thank you for watching.